I'm emphasizing sleep, so the question is how to sleep. I talked a little bit about shifting down from fifth gear to neutral. If you're struggling with that, go get a good psychologist and work with them, because that is a really critical piece. So now you're not necessarily stressed, but you're not sleeping well. So I'm gonna give you a bunch of the things that I've learned that interfere with my clients' sleep, and it's taken me 25 years to get them all, and I'm gonna hand them to you now. First, get rid of caffeine. Your body might not metabolize caffeine well. Personally, if I have a cup of coffee at 10 a.m., it's still in my system at 4 a.m. and I can't sleep. Things I'm gonna ask you to do are not easy, but you need to do them if you're having trouble sleeping. 2, if you're on an antidepressant, go talk to a pharmacist. Find out whether with the antidepressant you're on, you have to take it at the same time of day. This next one isn't for everybody. If you're on other medications, find out whether they can impact your sleep. Maybe you want to adjust the time of day that you take them. This one is massive. You don't have to believe me, but experiment with it for a week or two. Go outside 30 minutes after the sun rises and greet the sun. If you do this, your sleep will improve within 2 weeks by 60%. I'm not saying stare into the sun, please don't do that. But I'd like you outside without a pair of sunglasses on. And what I do is I go out in a brimmed hat because I don't want big sun exposure. I'm not wearing sunglasses. I walk for 10 minutes. When you do this, what happens is you set your circadian rhythm. Your brain starts to produce melatonin, and 14 hours later, your melatonin levels will be at a peak and your brain will send you to sleep. Now there's a second piece. I'd like you outside, say goodnight to the sun 30 minutes before the sun sets. Just go out for a walk for 10 minutes. What happens then is your brain turns off the danger response and your anxiety level drops and you sleep through the night. You've got to monitor what time the sun rises and the sun sets. In Calgary, Alberta, the sun sets at 10:15 at night in the summertime, and it sets before the workday ends in the winter. My clients who participate in this, their sleep magically gets better. Stop drinking alcohol and stop smoking marijuana. When you've got a really big job and you finish work really late at night, you're just trying to numb yourself out so that you can lose consciousness. When you're on medical leave, you don't have to do that anymore. So you will probably find it easier to give up these substances. If you can't give them up, reduce as much as you can for harm reduction. The reason is alcohol, 1, is a depressant, and 2, alcohol interferes with the normal pattern of brain waves required for sleep to be restorative. Your level of anxiety is much higher when you're a pot smoker than if you don't. What we need you to do is get calm. So anything that dysregulates you, for now, while you're in recovery, I'd like you to eliminate it. Disconnect from the news, and also stop watching movies that are scary. Stop watching anything that starts to make your adrenaline rise. Please stop eating 2 hours before bed. Digestion can really interfere with your sleep. And also, you're going to hear this from absolutely everybody, eliminate your use of screens a couple hours before bed. This one is really, really helpful. Get a jigsaw puzzle into the house and start doing jigsaw puzzles. Lots of people absolutely love them. What is it? You're going to the cabin. You're escaping from daily life. You might be asking yourself, how am I going to do all this? This is overwhelming. And I've got a tip for you here. Make one change every Tuesday. Write it down in a list. Prioritize the things you think you can do the easiest. And then every Tuesday, say, what behavior modification am I prepared to make today? If you're feeling intimidated, if you're feeling powerless, if this is all overwhelming, see your physician, see a psychologist, ask for help. I'm Dr. Patricia Turner, registered psychologist in Calgary, Alberta.